Hi, I'm Andrea. I'm one of the nurse injectors here at Cynthia Gregg MD Face and Body Specialists. And today we'd like to talk about discovering and rediscovering yourself in your 60s. Jennifer and I are going to talk about the changes that occur in the age group of 60 plus. So Jen?
My name's Jennifer. I'm the lead medical esthetician, and as Andrea said, we're going to talk about 60 and above. When I consult somebody 60 and above, I basically am going to discuss their concerns with more what I call wear and tear on the skin. There's a lot more visible sun damage, a lot more redness. Due to hormone fluctuation, we're going to receive some more crepey skin. I'm working a little more superficial, as well as doing some things right above what Andrea is going to mention. So I can tighten the skin with some treatments, as well as the skin at home routine. But once Andrea brings up her injectable type of things, she's going to really be able to address the deeper things. So skincare wise, I typically am going to have to dive in a little deeper than my younger age groups. We're going to interject more hydrating ingredients. We're going to boost even more antioxidants, vitamin C's, but add on some resveratrol as well at night. Those types of things are going to strengthen the skin because we also our barrier starts to weaken with age. We're going to definitely interject, probably if you can tolerate, more aggressive retinols, retinoids, tretinoins, and also add in peptides, growth factors. At this point, we kind of need all the help we can get in terms of regenerating cells, stimulating collagen, and working on, like I said, the superficial pigment and things of that nature. Sunblock's always a must. And in treatment world, I would also recommend chemical peels. We usually start with light ones, especially for clients that are a little nervous. And then I definitely will go into things like laser resurfacing, microneedling, soft wave, which is a tightening treatment, will lift the skin. A lot of times we're going to, like Andrea's going to discuss, we're going to work together on these modalities. It's not a one size fits all. There is no silver bullet. A lot of these modalities will also take you to your consultation perhaps with Dr. Gregg. Nothing's replacing one thing or another that we do in our office. So with that said, we'll turn this over to Miss Andrea and she'll talk to you about the deeper things.
Thank you, Jen. I'm glad that you mentioned a lot of the superficial things that you do to help people in their 60s improve their skin. And my focus when I do a consultation is to talk to patients about the volume loss that occurs in patients or people over 60. So also during the consultation, we will discuss on an individual basis where the volume loss in that particular person has occurred. Sometimes it's more temporal, sometimes it's more in the mid face, and sometimes it's more in the lower face. So each consultation is individual for each patient. Also want to talk a little bit about neuromodulators and what they can do for patients in their 60s. Most commonly, we're going to inject this muscle called the glabella, which is going to raise the eyebrows and give a little bit of a lift to maybe a little bit of laxity that you have in the upper lid. Crow's feet are an especially important area. We can inject neuromodulators in the lower face to help give a little bit of that more defined jawline. Platysmal bands, again, to just soften the bands and give a little bit more of that jawline. And there's also one of our new favorite products called PDGF. It's called platelet-derived growth factor. And it really is an amazing product that we can use to restore volume naturally. So it's going to stimulate your body's own collagen and elastin. It's not a gel. It's not a calcium product. It is platelet-derived growth factor, and we are seeing amazing results with it in the tear trough area, and it's also a boost. We can use it as a boost in your hyaluronic acid products or even in your biostimulatory products. So make sure that you ask questions about PDGF. How have you been finding your PDGF, Jen?
That's such a great question. So PDGF has changed the game in also some of the skincare I can offer. Typically, we've heard of PRP, but platelet-derived growth factor is, you need growth factor to stimulate collagen. So it is the direct line that will fire off new collagen and elastin, as well as pushing more hyaluronic into the skin and stimulating your own hyaluronic. The key way I'm doing this on the skin is microneedling, aqua gold treatments, basically something that's going to drive the product into that skin so that the skin on a cellular level can then utilize it, start the process of making everything it needs to make naturally. So I do love that it's more of that organic type of way of just reminding our own body what it used to do on its own.
And what about hair growth?
So I did not even expect to get into the hair growth arena. However, I have tried this on several different patients now that have thinning hair, whether it's hormone related, or just men that have a little bit of that hair loss, but it's not completely gone. And after one treatment, I have seen little hair growth come up, and it is a faster process than some of the previously mentioned different ways that you can do this. There are series of treatments that you have to do, and those types of things we would go over in a consult. So again, if you have any questions, please go ahead and email us or just call the office and make a consultation appointment with myself or Andrea. We hope that you've enjoyed our talks today about discovering and then rediscovering your skin. And if you do have any other questions, please call the office or email us. And we hope you've enjoyed our presentations today.
Thank you.